It is with immense pleasure that I welcome you back to the American College of Surgeons Bulletin Brief from the Frontline Surgeons' Voices. And with me today is our soon-to-be president, our president-elect, Dr. Julie Freischlag. Welcome, Dr. Freischlag.
Well, thanks so much.
It's great to have you, Julie. I've enjoyed all the years spent under your guidance and leadership when I was a neophyte on the Board of Regents, and now at the other end, and seeing well, to be able to welcome you coming in as president is a wonderful circle to close, as it were. And I'd like, if we could, to ask you to give us a little bit of a glimpse of how you're going to kick off your presidential year.
Great. Well, I appreciate that, Steve. I know I couldn't believe when I thought back that 9 years ago, I remember you came in because there were 6 of you at once, and getting to know all 6 of you to orient you, and what a job you've done with really accelerating our social media, our presence with videos. One, we had to, COVID-19 sort of made us flip, but also you did it with such joy. We all look forward to listening to people speak as well as reading. So my plan, my theme this year is going to be enhanced postoperative recovery. So all of us have spent so much time, especially in your field with colorectal surgery, certainly in my field of vascular surgery, preparing patients so that they're best suited to go into their operation, whether it's exercise, diet, radiation therapy, whatever they need pre-surgery, and then making sure that we set them up for great outcomes after surgery. And certainly COVID-19 has taught us how to do hospital at home, how to wear wearable devices at home, how to monitor people. We even have a study going on here at Wake where we're looking at coaching. So you go home after a stroke and we have a group of people that get a coach that calls in every day saying, are you walking? Are you doing the right things and eating versus on your own? So we're going to talk about that. How do we get on the other side of the pandemic from this? How are we, what are we doing for ourselves, for our patients, for our communities to get on the other side? Because here we are in our 3rd or 4th wave, and nobody even talks about this being the last one again, because this virus is so sneaky, it's going to come back again. But really going on the other side of that, and also making sure our patients get care. There's so many patients that have delayed care. I talk about that in my talk, and are scared to come in the emergency room, and are scared to come because they need to work now. We have staffing shortages in the hospital, which is something we never thought we'd have such extreme numbers with that, and everyone's got it. One of my psychiatrists told me that everyone suffered from COVID-19, so now it's appropriate to be depressed because everyone got the same hit. No matter who you were, you couldn't do what you wanted to do. So along with that, we're going to have a hashtag because we really have championed social media, thanks to you and many others, where we're talking about the American College of Surgeons on Instagram and Facebook. And so the hashtag is going to be Surgeons Sowing Hope. And the way you spell that is SOWING, but of course it's a little play on words. And we're hoping to use that hashtag to have many of our previous leaders and our present leaders talk about it maybe in a minute or two, how they're going to have enhanced recovery with their practices, with their families, with their communities, and how they're sowing hope so we go forward. So we're excited to do that. I'll probably do one every few weeks as well. Similar, I sort of took that away from how Scott Levin did his 100 words. So we hear from each other, and then allowing people to inspire us to go on the other side. Possibly talk to the Young Fellows Association, the RAC, students. I think there's many people we can talk to that will have a whole menagerie of sowing hope. So we're excited about that. So we'll continue the Racial Equity Task Force. We'll keep working on that, but then we'll really pay attention to going forward with Surgeons Sowing Hope.
Well, that's a great initiative, and I'm thrilled to know that there's a hashtag with it. As you mentioned, I have a proclivity to social media. I guess it's beyond a hobby at this point. Immensely enamored by it, and it would be great if we could get many of our past leaders to get involved, even if their foray into it, their initial foray is using your hashtag of Surgeons Sowing Hope to get people engaged and involved. And we'll continue to work with the regents, Patricia Turner and myself and the communications team as much as anybody wants to get that message across. But I think you hit the nail on the head with the young surgeons. And I also think that you may even get a lot of pre-surgeons involved. In other
Yeah.
words, undifferentiated college and medical students who are thinking about it. And I'm wondering if you have any particular plans, specific plans in that direction.
Yeah, that's a great idea. Certainly, I was just on this last weekend. We had our regional Association of Women Surgeons meeting, and my younger partner, Gabriela Velazquez, actually told her life story. She came from Mexico and came up here and trained at Emory and then at Gainesville and is with us. And it was so wonderful hearing a story 20 years behind you of a person coming in and where it used to be, at least in my field, looking at women surgeons, a table for 4. Now we have 70 or 80 or 90 that show up for vascular surgery to do that. And this was run by students, so it was great to see them interact. So I think we can use the Students Society that Steve Yang's been running. I gave my talk for that for the Congress, and certainly use the Association of Women Surgeons, and perhaps really even look at the some of the program directors in general surgery and even some of the dean's offices. I think that's a great idea. But you know them, if they see it out there, they'll probably jump on and tell us anyway, that we just have to probably just let them know it's out there, and they'll be more creative than you and I ever could. I do think that's the latest thing I do is when you put a team together, you need to make sure you add more young people. I'm on the board of the AAMC, and we just expanded our board of directors to include a mid-level career faculty member so that we can actually hear from younger people versus those of us that are more in our senior part of our career. So I'll open to any suggestions from you, but I think that's exactly what we need to do with the students that are involved with the college and beyond.
Yeah, well, that's absolutely great. And I think that in many ways, social media is the great equalizer. It democratizes the conversation because somebody who would be very keen to retweet or post something from you wouldn't necessarily approach you at a meeting to have a conversation, but they're comfortable to have an electronic conversation. And therefore the message is amplified, and you end up working with people and collaborating with people and even mentoring and sponsoring people through these various channels of communication. So I think that's great. You also mentioned the DEI initiative, which is of course something that was started this past year, Tim Everline and others, and that's taken off. And maybe you can outline for people about the plans at the college during the year with the new office and the pillars and such.
Yeah. Well, I think it's going to be a great time to be able to include those that we know can contribute. So I think as the new pillar evolves and others want to come in, our more diverse surgeons are the young ones too. So I think making sure we continue the incredible increase in membership we've seen over time, whether it's those in the United States or international as well. I think I've got 4 or 5 talks that I'm already giving internationally, because we can do it virtually now, to the Philippines, South Korea, Colombia, Egypt, that we're actually talking about enhanced recovery, sharing the hashtags so that they feel comfortable as well too, until we can get back to meeting, or even when we do get back to the meeting, our international colleagues always have struggled trying to get there either financially or for the time it takes to do that. So I think as we go forward, making sure we put all the things we're doing on that hashtag, because I do think DEI is surgeons sowing hope, so that we look better for our patients, we look like our patients, and we attract those students to surgery from our classes. The one thing that did happen this year is because there were virtual interviews for medical school, there were a marked increased number of those applying to school, increased 18%. And I know my medical school class is much more diverse this year because it was easy to interview. You didn't have to impress you or me, Steve. We didn't have to like or not like them. They just told us who they were. And then when the interview came, it was really us trying to sell them on our institution. So they were able to express themselves without someone judging what they were saying. So our class ended up with 15% Hispanic and 15% African American this year, which is actually 3 times the numbers we really get. So now we have to make sure we take care of those students and make sure they feel part of the team. And But I do think there's some real good opportunities as we flatten the curve for interviews, not only for medical school, but for residency, that many more can apply, that we're able to hear them without judging them, and that we actually can talk about the interests we have in diversifying our workforce.
Fantastic. And some of the other areas of the college, some of the other divisions, of course, the advocacy area, health policy and advocacy and education. And just to touch on those two, advocacy is relentless, tireless, because things are always changing. Any particular things there that you see happening in a different manner than they have been, or the status quo of relying on Christian and Frank and Patrick and everyone in DC?
Well, one thing I've seen is that you have access a lot more to the politicians virtually. So again, another thing on the list of COVID-19 and what it's done for you lately. Certainly, Christian has done an incredible job intersecting that. And the other groups where I work too with the AAMC, they've really taken some good stance on trying to decrease or eliminate the proposed cuts to surgeons, because everybody knows they're trying to increase it in other areas, but at the same time, it's going to have to decrease in the surgical area. So trying to make that a whole sum not be so bad. And everybody sees it. They understand the issues with the surgical groups. So I think continuing to work on that, also to show our worth, to make sure they understand how valuable surgeons are with the diseases that people get, especially as they age. So I think we'll continue with that. I think the COVID-19 piece and all the work the college did in order to enhance the knowledge of how to take care of those patients, how to work through the pandemic, was priceless, was really setting such a high gold standard that we can continue to do that as we get more and more into value-based, where we really show what we do with early intervention and doing operations to make people live longer and in a better way. I think the more value-based we can show, the better off we'll be in the advocacy arena. Certainly the education piece has been incredible. We've been able to teach and train and do so many things now online for our medical students, our residents, even for us adults that need to see and do things. We've gotten so much more comfortable with this venue, even though we really would like to see each other. So I think there's going to be hybrids forever, that we're going to see people be able to either hybrid the college or watch it later if they can't make the college piece, or having those opportunities where you can watch, maybe not participate, but you can watch real time if you can't make it. I think it's going to give great flexibility to our young surgeons who have families, so you don't have to travel just for one course or one opportunity, or you can see it later. So I've really learned that there's many benefits to doing it virtually. Now, that being said, this week I'm giving a few talks in person, and boy, I can't wait to see people, to actually get a real question and have a dinner with a real person. So I'm a little excited about that, to do it in person, but you certainly can do it this way as well.
Yeah, understandable. And the last area is to touch on education, as you say, will probably remain in some hybrid sense, which is also great for our international
Yes.
fellows and members, because, as you also mentioned, the cost is prohibitive for many of them to come to the annual clinical congress. But this way, they can still, come, whether real time or subsequently, participate. But that also brings out the quality programs. And when you look at quality, virtual site surveys have gone very, very well in trauma and in cancer and in other areas, Red Book and such. So do you envision a day when more college quality programs are being brought to other countries because it can be done in a virtual manner, which is much more cost effective, both for the receiving or being certified accredited body, as well as for us in the college?
Absolutely. Actually, we had the Joint Commission just come a month ago that we only had one or two on site and the rest was virtual, and it went great because you could really focus on the things you needed to focus on in order to be a better institution. We thought it was the best Joint Commission visit we've had, and I gave oral exams, vascular surgery boards orally, and it was great, again, for that same reason. The examinee wasn't breathing your air, so they felt very, very comfortable. And in talking to Dr. Hoyt, too, the decreased expense of us doing the surveys perhaps can decrease the expense of being part of those programs. And that had been some issue, I know, internationally as well. And also, you can do it quickly. It's for the people that do the visits, they can pop in, pop out. And then if you feel you need to to go see something, you can, to make it happen. But I don't think we're going to go back to that. I think we can actually oversee, and they actually did a couple of the college visits at Wake also that way, where we were looking at simulation, and it works really well. And I'll tell you, the new generation is comfortable. I have a granddaughter who I just met for the first time at 11 months in June. And when I had my mask on, she didn't know who I was. But when I took it off, she knew me from FaceTime. I mean, and could say my name, and she felt she had known me that whole time. Now I got to hold her, and that was a whole different thing. But I do think we can make quite an impact virtually that then can be reinforced afterwards. And certainly my patients love post-op visits if they're doing well virtually, no question about it, so they don't have to travel. But if they're having issues or problems, they like to come see me.
Congrats on the grandchild. That's wonderful.
And that's number 4.
And congrats on your upcoming presidency. We're certainly looking forward to the entire world of surgery benefiting under your guidance and your innovative, inspirational leadership. Looking forward to your talk, your presidential address at the annual Clinical Congress, and to definitely promoting the Surgeons Sowing Hope initiative. All
Yes.
great things.
Well, we've been inspired by you this year, Steve, that you made us want to come and talk, and it's been great. So I appreciate that a lot.
Well, thanks so much, and looking forward to seeing you in person, hopefully in the not too distant future.
That would be the plan. Thanks so much.
Thanks.